but what are you thinking when you're writing the manual, how it might help practitioners that you haven't even met yet?
I hope that it does. I hope that it helps people to feel more confident when they're doing NET, that this really works, that it might look weird and their patients might think it's funny, but it definitely works. And this is a very profound treatment, and it really can change people's whole lives. I mean, we were working on one snapshot, maybe 1 minute of their lives is what we were treating in this study, maybe 3 minutes at the most. You know, we were picking these short snapshots, they're not long. And just treating that 1 minute of their life, you know, changed everything. It changed everything. And so I think that I wanted to make it clear to practitioners how easy this is to do. That if you follow it, that you stay true to it, if you stay confident with it, it really can make a difference. Right?
So the same thing applies to other types of conditions that you see in your practice. It's the same thing,
Yes.
except you don't have the advantage of the functional MRIs and the
All the bells and
biofeedback.
whistles.
You don't
yes.
have all that stuff. You're just going on a clinical hunch. Maybe subjective units of distress, maybe the only one that you had to work on, but it's the same principle.
Yes, it is. It really is.
Do you think the mechanism's the same, how people get traumatized by various things in life and then they heal the same way?
And listen, for everybody, Scott, it wasn't the cancer moment that was the most traumatic for them. I mean, everybody tested for original events that, you know, predated having cancer. And many of them had the kinds of trauma that even if somebody who's watching this video doesn't treat medical conditions per se or doesn't work with patients with complex medical conditions, that these were patients who were abused, who were victimized, who were belittled, who were humiliated. You know, all of the things that happen to people during childhood that are difficult and traumatic and scary and uncertain. And so that is really what you're treating. Whatever you're going in on, whatever the kind of current day situation is, it all goes back to something more complicated and more scary.
Have you learned anything technically about the various meridian points? Did you find any more active than another?
No. I found that it was evenly distributed. I wrote down all the emotions that I worked on, and I kept careful notes on everything. And I went back and I reviewed it all, and there didn't seem to be any patterns that at least I could discern. I didn't do any kind of comprehensive statistical analysis, but I would say clinically, no. There was a range of issues, and I think that makes sense. There are a range of different cancers, range of different issues that people came in with.
Well, here's something that you're good for me. Send me a bill, tutoring bill, and I want to. But I want to talk to Dr. Monti about this too, because one of the things that's held up the research in the complementary integrative alternative medicine area is that Western diagnoses take a certain set of symptoms and they give it a name, pattern of symptoms, and then that's the diagnosis, and then that's what you treat. And in alternative methods, we're not so much worried about making a diagnosis. We want to take care of the patient that's in front of us with whatever is bothering them, whether it has a name or not. And the aha moment for me was, yes, we have the 12 steps or the 15 steps of NET. That's concrete. But the variety of the experiences that got people is almost infinite. In other words, one might be with anger, one might be with grief, one might be, and it might be from their father, their mother, their little brother, or their dog died, or something. And so it's an infinite variety that way.
Yeah.
And when you're treating someone with homeopathy, for example, is that your sinus problem isn't like my sinus problem. Your sinus problem is on the right, mine is on the left, yours is throbbing, mine is sharp. Mine is in the
Right.
morning, yours is in the afternoon. So they got the same name, but they're completely
different.
individual.
Yeah.
And so what you're saying here, with going back through your notes and looking at the various emotions and the stories behind each one of those emotions, if you could ever get enough secretaries to take all that data down, is we're treating very, very individual situations and individual patients, which is the way that it is.
Yeah, it's absolutely customized to the individual sitting in front of you, and their body is leading the way. You know, his or her body is guiding you and helping direct you so that you get exactly what they need. And that's the wonderful part. And in the manual, what I put in is I talk about how to set it up. How do we best go in to capture this? How do we capture the present day distress? And that is really what I think the manual can bring to people. And that sort of really enhancing the step one, getting the snapshot in the present day. And that's what I tried to spend a lot of time on in the manual, is how do you capture that snapshot? And I actually give lots of examples from the real study, exactly as they were. I mean, I changed the details, of course, but so that people know exactly how you phrase it. What kinds of wording did people use, and what looks like to elicit the strongest reaction? Because what you want to do is you want to go in on something that's a distress level of a 7, 8, 9, or 10, because the higher it is, the more room you have to go down. If you start with something that's a 5, it's not really bothering them that much.
Some of the people that are going to be watching this video are not practitioners, and they don't know what we mean by snapshot, and they don't know what we're talking about that. And I just want to, for them, what happens in the procedure is that there are times, and everyone's experienced them, so they'll know what I'm talking about. There are certain incidents in a person's life that are traumatic and stay with us.
Yeah.
And that's what we're talking about, the snapshot. Isn't
Yep.
it? And your whole focus on the manual is to get them to that snapshot.
Yes. What we're starting off with is a snapshot of the present day distress. So what we're trying to really do is comprehensively and specifically and accurately detail what is most stressful for them. What is it about that moment of diagnosis that was stressful for you, so that we can get the strongest feeling? And we talk about that and we look at that, and then I map the points on their wrist, and then we find the emotion, and then we work back through time, because what we find with NET is that there are original events in our lives that impact us in the present day that are occurring in a place that is preconscious. We're not aware that we're driven by these earlier events, but we are. And they're affecting us, and they're increasing our distress in the present day. And so we do a very, very easy but very efficient way of breathing and holding these meridian points. And when that happens, while they're thinking about this original event that was stressful, the body actually heals, and it changes the physiology. From that point forward, they continue to feel better. I mean, you called them, some of them 6, 9 months after the study finished, and they still felt better.
Well, I could talk to you forever, and I just am so appreciative.
I'm so happy.
I'm happy that you helped. I'm happy mostly that your mother had this experience. Mother knows best, and that you took the training. You stayed with it, even though you didn't use it immediately. You stayed with it. You got yourself immersed in it. You learned how to do it. Then you were willing to do the study, and then you're willing to come out and do this interview and write a manual for the practitioners. So I applaud you. Thank you.
Thank you for giving us such a wonderful tool, Scott. We're all so grateful to you
all,
and everything you've brought to us.
And I thank my teachers that have taught me. God bless you.
God bless you, Scott.